Hi, I'm Dr. John Barris, cosmetic dentist here in Houston, Texas. I'm here to talk about smile makeovers. So when a patient wants a smile makeover and they call our office, we would have you, the patient, come in. We would take photos. We're going to take a shade tab of your teeth to see what existing color your teeth are. And then we're going to take other shade tabs for you to look at to see exactly what shade of the teeth that you want in the end. We're going to talk about size. We're going to talk about shape. We're going to talk about all the nuances that go into making the teeth exactly how you want. Anatomy, translucency. There's a ton of aspects that we're going to go into to make them exactly how you want. We'll even look at other before and after photos of pictures that you may like or the existing smile makeovers that we've already done. Once we do that and we have the photos, we'll take impressions of your teeth. We'll send all that out to the lab and they'll do a mock-up on your models of your teeth. Then you'll come back and you'll take a look, make sure that everything is to your liking. Once we do that, then we'll be ready to do the smile makeover. We'll have you in, we'll prepare the teeth, and you'll leave actually with the teeth, the design that you picked out. From this point, then you can go home for a couple of days and really get to adjusted to how the new teeth look before we ever do the permanent porcelain veneers or crowns. So this gives you some time to actually try it on. If there needs to be any final tuning or adjustment or rounding some corners or lengthening things or making things a little bit more straighter or less perfect, then we can do that. And then we take photos of what you like at the very end there and take impressions of that, send it to the lab. The lab is finally at that point ready to make the porcelain veneers or crowns to exactly your liking. That way when they come back in, we'll have you in, we'll try them on, and then you tell us that you like them before we submit them. If there's anything that you don't like, we send it back to the lab, put the temps back on, and get it done exactly perfect. So there's a weeding out process before we get to the end, and there's no surprises at the end. So once we do that and you're totally happy with everything, then we cement them on permanently, and then you're free to go with your new smile makeover. Another thing to note, what sets me a little bit apart from other dentists, is that I'm also a neuromuscular dentist. So when a patient comes in and we take their picture, some people have a broad smile and they show every tooth in their mouth. So if that were the case, then to do a smile makeover, you want to make over everything that shows in the smile. So if all the teeth show, then we have to make sure that the bite is in a good position. If the bite's not in a good position, the porcelain may break, just like your natural teeth may wear and crack and things like that. So it's important that we put the porcelain veneers and crowns in a good bite position so everything lasts a long time. So that's what a neuromuscular dentist will do. And I've had 3 or 4 extra years after dental school and training to make sure that we get the bite in a good position and aesthetics and function work together. If you have any questions about cosmetic dentistry, smile makeovers, or neuromuscular dentistry, please call our office at 713-993-9814.